Hello, everyone, and welcome to this UN Behavioral Science Week 2025 session, Expo session featuring case studies from across the UN on the topics of policymaking, urban settings, and driving change. So my name is Mary McLennan. I'm the Senior Advisor in Behavioral Science to the Executive Office of the Secretary General. I also lead an initiative called the UN Behavioral Science Group, which we'll come to shortly, because the UN Behavioral Science Group is actually coordinating and hosting a UN Behavioral Science Week this year, bringing together 15 events, 46 entities, and over 60 speakers. So there's lots to check out. We're just on day 2 here. Just right after this session, there's one on the topic of behavioral science for evidence and decision making. We also have a few sessions tomorrow on behavioral science and AI and behavioral science and data. So lots to check out throughout the week. So if you haven't seen the agenda, I encourage you to check it out. Also, just a little bit here on the group itself. So the UN Behavioral Science Group brings together over 7,000 members from more than 70 entities in 150 countries. So there's lots of interest, demand, and need when it comes to behavioral science across the UN. So this group is really tailored and targeted toward UN colleagues interested in behavioral science. But you can also join if you're outside the UN as an observer. We have observers from academia, NGOs, international organizations outside the UN, private sector, etc. So everyone's welcome to join and be a part of our discussions, the ones that we hold virtually. We also publish publications. You can hear about those if you join the group. Okay, so just a little bit here on the bigger picture. So behavioral science is part of this UN 2.0 quintet of change. These are 5 areas the Secretary General has deemed important for the UN to be nimble and effective and really deliver on its ambitious agenda. So they are behavioral science alongside data, digital transformation, innovation, and strategic foresight. So really amazing to see behavioral science elevated up in this way by the Secretary General and the Secretary General's office, and lots more to think about throughout the week in terms of how behavioral science might even intersect with these other areas across the quintet as well. Okay, so just if you want to get engaged with the UN Behavioral Science Group, as I mentioned, we have a number of publications that you can check out, including the UN Behavioral Science Review, which features case studies from across the UN, as well as the UN Secretary General's Guidance Note on Behavioral Science. And of course, you can also join the group if you haven't done so already. Great, so on to our speakers for today. So we have six speakers who will be speaking across 3 breakout groups over the next little while together. So the first breakout group will be behavioral science and working with policymakers. So this will be Natalie Khaled from UN ESHRA, as well as Adriana Alberti and Cristina Rodriguez Acosta from UN DESA. We'll also hear about behavioral science to drive change and adaptation. So here we'll hear from Nathan Kivua from FAO, as well as Juliana Ribeiro from DMS-PC. And then we'll also hear about behavioral science in urban settings. So this will be Estrella Merlos from UNITAR, as well as Isabel Wetzel from UN Habitat. So with that, over to Natalie and Adriana to kick us off.
So today I will share some of our key initiatives on behavioral science at Expo, sharing from challenges, impacts, lessons, and future directions. Allow me please to share my screen quickly for a quick overview of the slide. All right. So at my work, basically with policymakers, I focus on national development and strategic planning. And in this type of processes, we see a lot of, plans that look strong on paper. They are well structured, technically sound, and aligned with long-term goals. However, when implementation, we observe that there is a big gap between planning and implementation. Sometimes it's a lot of stakeholder commitment. Other times it's behavioral patterns that lead to deviation from the intentional path, both by policymakers and by citizens. That's where behavioral science becomes very critical in this work. It helps us understand the real drivers behind decision-making, including biases, habits, and contextual factors, and offers practical tools to address them. To build further on why behavioral science matters in public policy, this slide shows 2 complementary processes. Behavioral insights help accelerate the impact and implementation of policies and programs. By better understanding how people behave, we can design interventions that are more likely to succeed. Also, it improves the accuracy of decisions made by policymakers. It helps uncover blind spots, reduce cognitive biases, and designs decision-making environments that lead to better planning and implementation. So it is in both ways, and it's also grounded in how humans actually think and act. This is some of our work that we've done. I've worked on during the past years. Most recently, I've worked on a paper published on behavioral science and consumer protection, where we discovered how behavioral insight can enhance both sustainability and consumer welfare at the same time. Also worked on induction meeting for member states in our region to introduce behavioral science in policy making. But the most important two products that I've worked on, which I'm going to talk about later, are the handbook on behavioral strategic planning and the online course that was developed based on that handbook. But before we had the handbook or we had the course, we had dialogue with policymakers. We had demand followed by dialogue, although because the topic was relatively new to them, it was underutilized in the Arab region, despite the growing challenges in national planning, especially when it comes, as I said, to bridging gap between planning and implementation. We had a lot we had to do over the course of around 4 years, a lot of regional and national meetings and workshops. We did also a train-to-trainer workshop on how to integrate behavioral science and national development planning so that we can prepare policymakers, prepare focal points and national offices on how to integrate this science into their work. Just to give you an idea also about the growing momentum in the Arab region, to see how many existing nudge units are there in the Arab region, because the region is really diverse, where there is least developed countries, there is conflict countries, there is developed countries, and there is middle income countries. So this combination shows us that in high income countries, for example, there are nudge units followed by middle income countries. In conflict areas, there are initiatives on behavioral science. Several initiatives have been done in countries like Sudan and Yemen. Also, to go further, as mentioned earlier, ESCO's strategic planning handbook and online course are built around the interventions of behavioral in 7 practical step processes. It starts with setting leadership aspirations, where we identify challenges, nudges, and solutions through each of these steps. And the idea is simple. It's to support policymakers in designing strategies that are behaviorally informed and people-centered from start to finish. I'll give you an example also from the behavioral handbook, where it's a case study where one of the goals of one of the countries was to reach a higher rate of having confirmed appointments or having confirmed in clinics and hospitals. So, for example, this is for outpatient appointments where they don't show. The intervention was straightforward through behavioral tool of reminders. It's a simple SMS reminder to patients. One reminder sent 5 days before the appointment, and another 1 day before their appointment. The message included date, time, and contact number for any queries, and the result was a 20% reduction in missed appointments. This is just a simple example of how nudges like reminders can improve efficiency and outcomes, especially when designed with real human behavior in mind. I'm not going to go any further, but I think if you wish to have any questions, or if you wish to dig deeper, I'm happy to share further about the work that we do. Thank you very much. Over to you.
Great. Thank you for that, Natalie. There's lots there to unpack in our discussion today. Okay, so next over to our speakers from UNDESA, Adriana and Christina.
Thank you very much. Good morning, good afternoon. Thank you, Mary. We are delighted to be here today at the Behavioral Science Week. So the work of UNDESA, that UNDESA has been leading, has focused on the topic of changing mindsets. And we have been looking at what is a mindset and why is it important to change mindsets. And we heard from Natalie, of course, about the importance of how humans think and act, and how to change behavior. And also how to work with governments and policymakers to shift mindsets. And also we will present some results. So the next one. Christina, please. So what is a mindset? So we all know that all of us have mindsets, and mindsets consist of the beliefs and attitudes that a person has assimilated throughout a lifetime about themselves and the world around them. The good thing is that mindsets, that is to say, the beliefs and attitudes that we hold, can be changed, but it is a personal journey. But there are many strategies that can help to change, to shift mindsets. And why are mindsets very important, and why is it important to look at the limiting beliefs and what kinds of beliefs are necessary to transform public institutions into more agile and forward-looking and innovative vehicles of change, is because mindsets affect behaviors and decision making. Therefore, they affect results. So this is one angle from which we are looking at how to change behavior. Next. And we have developed a mindset and competencies framework based on SDG 16. So looking at public institutions, what kind of mindsets are needed to promote effectiveness, accountability, inclusiveness. Here I just have a few because we don't have enough time, but everything is available on the DPIDG UNDESA website. So looking at what are the mindsets that are needed today, but also for the future of governance, like an agile mindset for system thinking, evidence-based mindset, of course, results-oriented, an experimental or growth mindset, and how do you nurture a growth mindset in the public sector, foresight mindset. And also I think that what we have tried to do is working with governments to look at mindsets across the quintet of change as well. So let me now move on to my colleague, Cristina.
Thank you, Adriana. So this is just an example of programs of capacity building that we have done in support of this agenda. And I also want to mention that the division has developed a curriculum and governance for the implementation of the SDGs. And this is a series of toolkits on topics from changing mindsets to transparency to national to local coordination for implementation of the SDGs. And they're also available on our webpage. We have also developed online courses on strategic foresight, transparency, and local to national coordination, and they're also available on our website. And we're now working on an online course on changing mindsets based on a publication by UNDESA on changing mindsets. So very briefly, this is an example of the work we have done. This was a workshop organized in Morocco for representatives of local and regional governments of Africa, SIDS, LDCs, and LDCs. And we work with them based on the quintet of change in key topics in basically 4 areas. The quintet of change and looking at what are the mindset and the competencies that are needed for governance transformation. Changing mindsets in the public institutions. And as Adriana said, this is a journey. So we work with them in understanding what it means to change mindsets and what they can do to change their own mindsets to then be able to influence mindsets in their institutions and organizations. So 6 months after the workshop, we reconvened with all of the participants because they had made commitments and action plans during the last session in Morocco. And we were pleased to learn that they have been implementing many of the action plans and commitments that they have made, and we're just highlighting some of them. There were over 45 participants, but I think we want to highlight the importance of the creation of a coordinating unit for the localization of the SDGs. This was done in Nigeria, so the local government has created a unit with the regional and the national government to work on the implementation of the SDGs. In Ghana, the establishment of a local government week to recognize best practices at the local level. Some have also dedicated budgets for youth, women, and persons with disabilities within their municipal budgets. There was a lot of conversations about training of the young civil servants on the SDGs, the implementation of manuals and procedures to work on SDGs at the local and regional level, as well as several initiatives in sharing knowledge and presenting to their communities about what they had learned in the workshop. And I think this is a good example of how we can be agents of change and support others in being agents of change at the local and regional level. So thank you very much for your attention.
Great. Thank you for those quick tour presentations of what you're doing working with policymakers around the world to apply behavioral science. So I see a few colleagues with us today who have worked with policymakers as well. So some conversations we could have with them, but maybe just a general question to kick us off. You know, for colleagues here who are in the UN or outside the UN and thinking about applying behavioral science and engaging with policymakers for the first time, let's say. What might you say to them in terms of some things to keep in mind, maybe some things to do or not do in different contexts, as opposed to dealing with academics or dealing with other colleagues in the UN or other spaces? What are some high-level thoughts you might have on that? And outside of that, I also see some colleagues in the chat. So hopefully we can have more of a discussion. So yeah, I'll turn that over to our panel, but then we can have more conversation with our speakers here too. So yeah, what do you think, Christina, Adriana, Natalie, for people starting out, what would you say to them?
Can I maybe have a
Yeah, go for it.
because thank you for that question. It's important to understand, I think, as you understand the contextual demand or the contextual framework of the request first, because it differs from, you know, what is the purpose of integration from one policy to another. And this is very important so that we can be able to adjust, you know, the advice accordingly. For example, in the Arab region, it's when working in planning, for example, it was important that we understand some challenges that LDCs, conflict countries are going through before we adjust or before we customize the priorities of behavioral interventions. It was important also to create awareness of the importance of the topic and how can it be utilized by policymakers. Because as I said in my presentation, it's fairly a new topic for, you know, many policymakers. It may not represent a priority to invest in or to put resources or to train the staff on. So it was important to create awareness and to show the impact from also taking other examples from other places and countries.
Adriana, please come in. Sorry, Adriana, were you going to say something?
Oh, okay. So I'll say something, and then I'm sure Christina has much more to add. But I think that when we work with government officials, you know, in various countries, what I see as one of really the key topics is how to develop an experimental mindset and especially a growth mindset. Because when we meet with government officials, we notice that they, as us, you know, hold these kind of limiting beliefs that then do not allow for transformation, progress. So understanding how to go from a fixed mindset to a growth mindset is extremely important. But it is a journey that we lead them through various hands-on activities. And I think that, you know, at the beginning of the workshops, they think that their abilities are fixed. There is no room for improvement. They see challenges, you know, as failure. Whereas after the workshop, I think that there is that kind of a shift in the way that they see and act and think, looking at not focusing on challenges, or if they focus on challenges, seeing them as possibilities for transformation. So I think this is one of the key lessons, and it's very powerful, the way that people think and what they believe, what they hold to be true is extremely powerful in the way that they're going to shape policy. So they start seeing possibilities where before they would only see problems.
Yeah, if I may add to what Adriana just said, which I really exactly the same thing, that is the journey. I think one of the things that is very important during the workshops that we carry is that, you know, we help them understand, and we do as well as we're interacting with them, that leadership is important, because the first reaction is always, well, if I'm not allowed to do this, I won't be able to do it. And I think part of the exercises is understanding that we are all agents of change. So we can change mindsets and we can work. So transformational leadership is also very important when we're working with government officials and policymakers in understanding, you know, what is the growth mindset, or what can I do at my personal level to influence that process. Thank you.
Right. Thank you for that. Yeah, it's a lot about changing, the context in which people are working and their understanding of that to really make it feasible to do something that's different. Okay, so we have a question from our colleague. If you'd like to unmute yourself and ask your question, please feel free to do so. Or
I assume you're talking about me, Mary.
sure. There were a few hands that were raised, but yes, go for it, Richard.
Okay, Richard Jordan, representing the Royal Academy of Science International Trust and their Royal Highnesses, Prince Adnan Al Hashemite and Princess Dr. Nisreen Al Hashemite from Iraq. Natalie, I did not see Iraq included in the countries that you listed. Does that simply mean that the countries didn't apply, or are there plans to involve the countries in the region that were not listed? Thank you.
Thank you, Richard. Actually, the regional meetings and the list of focal point does include Iraq. So when we started the project on our national planning handbook, and then we developed a course, it was followed by, before that, there was a series of workshops. We had identified with the policymakers focal points from the national planning ministries or departments and ministries. So, and these focal points were assigned officially from all member states, including Iraq. Now, Iraq may not have a formal nudge unit, but definitely there are specific initiatives. However, they are always included in our workshops and at the regional level. We haven't done any workshop at the national level yet. Thank you.
Thanks for that very robust explanation. Thank you, Natalie, for that. Okay, so any other colleagues who'd like to jump in, feel free to unmute yourself and ask your question. There are only so many of us here.
Hello?
Hi, yes.
Yeah, I'm Kaje. I'm from UNDP country office in Mauritania. So I hear Christina saying that they have a workshop in Morocco, it's not far from here, with some of administrative. But, I'm also working on elaborating of policies. And my questions is that one part of my thesis was about this theory from Paul Sabatier, he's a French theorician who elaborated this theory about coalition framework. He said that one of the main of his theory is that we have deep core. The deep core means that is a coalition of people who think of some values and share it into a policies. So into a policy, sorry. So my questions is that if that deep core that is Asians most of the time is composed by people of a certain kind of person in society, so most of them are leaders. So, and who have some values and who shape the policy. My question is going to the fact that is that value at the same from people at the at the down of the stair? Because we are here to answers to the questions of people who have needs. We are here to answer to the questions of our populations, and they are there to be also actors of their own development. So she talks about the fact that the transformation come from the mindset. But to end my questions is it will be mostly being about do we taking care about the mental health of leaders? Because for me, everything that's going around shaping mindset going with mental health. Do we know any things that can be links also, because behavior means manners, but do we know how we can shape their mental health with also their leadership? Because if we disconnect it, we will not have links with what populations that is down on the stairs have as their needs and want to improve themselves. So it's just my questions. Thank you.
Over to the panel, it's about leaders, about sort of mental health, any thoughts on that when it comes to working with different colleagues in different parts of governments. And yeah, over to you.
Well, I'm going to try to answer your question because it's a complex one. So I'm just going to give what I think. I think when it comes to, what people want and the pressure for leaders, I think what we all want is for the SDGs to be fulfilled, right? So that basically covers all of the needs and wills. And yes, values, as Adriana said, are deeply held and they influence the way we see and we act and we understand what we can change. I personally, I'm not very familiar with the literature that comes to mental health of leaders, but I think that comes up when we're doing the workshops, because the mayors will talk about the importance of serving their communities, but at the same time, the pressures and the needs. So I think conversations about, what it means to be transformational, what it means to be a leader, what it means to be a good communicator, a good way of serving helps them also think what's their role as leaders. So when we're doing the workshops, we basically work in listening to those who are in the room and understanding the context, as it was mentioned by our colleagues, because that helps us shape the conversation and help understand.
Hello, everybody. Welcome. I see some faces are here from before, hopefully some new faces. We have Isabel and we have Estrella here, who are our speakers. I don't know if we want to mix it up and switch the order this time. Estrella, do you want to lead, take the first presentation? So yeah, everyone, welcome to Estrella, who's at Unitar, who's going to share with us some insights, and then we'll be over to Isabel at UN Habitat. And then there'll be a chance for some Q&A. If you have questions in the meantime, please do put them in the chat, and we can come to them in a moment. Over to you, Estrella.
So thank you so much, Ruth, again, and it's such a pleasure to be with all of you. Elena, good to see you again in the room, and Isabel, very nice to see you all. Thank you for joining. So UNITAR is the United Nations Institute for Training and Research. Our core mandate is to provide training and offer and build capacity of our member states. I will focus on particularly in the area of road safety. We have a global training initiative dedicated to provide training and learning opportunities on road safety. And one of the approaches we have been using is, of course, social norms and behavioral change, or behavioral science, to improve road safety and through behavioral change. So just start by saying why are social norms powerful, or what are social norms? I'm sure all in this room know that they are a set of well understood but many unwritten rules about behavior and attitude shared by members of a community, a family, or a group. These rules define what is acceptable or appropriate or sometimes obligatory in a society, includes beliefs about what others in one's group do think, what they approve or what they disapprove. So evidence tells us also that we value and are influenced by what is valued by significant others, that we are biologically and socially disposed to copy behaviors of those around us, that social attitudes and behavior change over time, and these perceptions and observations about what others think and do are the basis of social norms. So influencing people's behavior is essential to improve public health, to advance sustainability and development, and their social norms are highly influential in shaping individual and group behavior. So on that basis, we have developed a toolkit and a series of training modules on how to design effective educational campaigns to promote social norms aimed at improving road safety. This is available in our website under the Road Safety Global Training Initiative. Through this toolkit, we look at how to influence or using a standard social norms approach. This is addressing misperceptions about social group norms, but also forming new social norms. For example, campaigns to foster or establish a new social norm in the community. Why road safety? The risk factors causing road traffic crashes and injuries. We know all of them: speeding, drink driving, not using seatbelt, not using helmets. Also, distracted driving is one of the main risk risk factors causing crashes. So what are we trying to do with this toolkit is to provide a theoretical framework around social norms and their role that social norm has in improving road safety, offering case studies applied to road safety, how effective campaigns can influence social norms, and also how to design campaigns aimed at changing road users' behaviors. So this is available online and presents case studies on, for example, what campaigns could be successful to reduce speeding, to promote the use of helmets, and so on. So happy to share the link in the chat for anyone who's interested in using it and downloading it. It's also available in different languages. Thank you, Ruth. Back to you.
Thank you so much, Estrella, for that. Really interesting to hear. And yeah, I'll pass over to Isabel, who's over at UN Habitat. Hopefully it will work with the slides this time. So over to you, Isabel. And I'll just give you
Thank you very much.
when you're almost out of time. Okay.
Sure. And thanks a lot. Yes, I did have tech challenges, so glad that this time there's a presentation at least that I can show. Ruth, please do share the link. I was not able to share it with the group somehow. I was only able to send it to you. So I wanted to talk to you today about innovation challenges that we have been running together with cities. We have a new guide that we just launched earlier this year, which is a step-by-step guide to how to design and implement innovation challenges in and with cities. And there's a lot of value addition to rethinking and redesigning the way that we engage cities. And we have identified that challenge-driven innovation is a great tool to collaborate with cities and other stakeholders in the innovation ecosystem in cities in a completely new way. And so by default, that has an implication on behavioral science, because that's a completely new way that we're engaging all the actors that are involved in solving challenges in cities. And so what this guide is about is it follows these 5 steps that we have designed, where we are giving very concrete tips and resources that cities and different actors within cities can follow very easily. Why is this so critical right now? Because we have the majority of an urban population of the world's population right now. There's a lot of challenges within cities that need new ways of addressing them. And also we have increasing new challenges, especially around climate change and digital tech, that this methodology is ideal for. So this is a quick snapshot of all of the benefits of running a challenge in and with cities. You can read up on that more in the guide. I'm not going to go into detail, but it offers a lot of positive ways of changing the existing system. And so this is the top one that you see there. Unlocking systemic change for us is a huge value addition that cities have not often considered in their way of doing work and designing policies, but really through bringing new innovative solutions to cities, they're able to unlock much bigger system transformation that goes then into the way financing to cities, with cities, in cities can happen, the way you're engaging stakeholders, the way you're maybe redesigning policy as a result, and many more positive aspects to it. So these are the 5 steps. One more time, I'll walk you through through them before closing. So the way an innovation challenge works is that you are first setting the stage. You're looking at what are the existing conditions that have to be met for your city to be ready to run an innovation challenge. Once you have done that, you go through a human-centered design kind of process to define what the exact challenges that your city wants to address. And why that is so important to narrow it down is because cities have a million challenges, but there's a way that you really look at one challenge within the bigger system only. But then through this process, you're also allowing stakeholders to feed into the process, to co-design the identification of that problem. And then as you have defined it and you are putting out a document that describes that challenge in detail, it allows innovators to now apply their solutions exactly to that problem. And once you have created that, you are going to design and launch the challenge. And that means you are going to launch and publicate all of the issues that innovators can then essentially apply to later. and then the challenge will be run, and the challenge will be open for applications from either around the world or within the city. It depends on the criteria that you're selecting. And then the fourth step essentially would then be that you create a jury, a selection panel of experts that will be able to assess the applications received from those who think they have solutions to the problems. And then, yes, I can see your hand, thanks. And then the last step will be that now once you have identified the solutions within the city, within the challenge, you will now work with the city very closely and with the different stakeholders to see how you can embed the particular solution within the existing governing structures. And that's very important because that's the process that I called earlier system change, where you're essentially revisiting procurement methods, policies, the existing market conditions around you. And so this is the process in a nutshell. I please do a look at the details in the chat, and then happy to respond to your questions. Thank you so much.
Thank you so much, Isabel. Perfectly on time, and appreciate that. And great to see your slides this time as well. Yeah, so now we have an opportunity for some discussion. If there's some questions from the group, feel free to raise your hand. I've already received a couple of questions in the chat. I know there's an issue so that it's only coming to me for some reason. But yeah, Richard, I saw your question. So please do come online, unmute, just maybe introduce yourself briefly and share your question with the group.
Thank you. Richard Jordan, Dean of UN NGOs, over 40 years every day in the building before COVID, with a question for Estrella. Ambassador Luis Gallegos, who has a great interest in older persons, was in the UN in the summer for the open-ended working group on older persons. Are older persons issues included in the toolkit? Thank you very much.
Thank you very much, Mr. Jordan. And yes, Ambassador Luis Gallegos is the president of our board of trustees. So yes, he's our advocate on aging and also persons with disabilities. So it's not included in the toolkit, but we certainly have a whole program around aging, and also in line with the disability strategy. So yes, we do have training, and also we have materials that address this specific topic. I'll be happy to share it here in the chat, Mr. Jordan, and thank you for bringing that to the discussion.
Thank you very much.
Thank you, Estrella, and thank you, Richard, for the question. There's also another question from Harsha Mehta, which came through the chat. Were any evidence-based studies done before starting for road safety, and what was the impact? Any reduction in road accidents, or is it best to look for the study on the UNITAR website? I think, Estrella, that's also for you.
Thank you very much for the question. And yes, in fact, the toolkit includes those case studies. And I can just mention one of them. For example, an example from the Department of Transport of England, the program Think, that it has been consistently implemented, I have to say, for 20 years. It has achieved, and I think, the goal and saved lives using a combination of social norms interventions as part of a multifaceted, sustained program. So yes, there are examples and case studies in the toolkit, lessons learned, also monitoring and evaluation, stakeholder engagement, and how the program or the project was implemented throughout time. So yes, the UK Department of Transportation has an excellent program, I think, called Think, that has been running for 20 years and is included there. That's one I can mention, but there are others as well that have a similar, have followed a similar approach, a social norms approach, with interventions with successful results.
Wonderful. Thanks so much, Estrella, for shedding light on that. Yeah, and any other questions? A last moment for a question or a reflection to share from the group. Please feel free to put it in the chat or to just raise your hand. Yeah, Elena, over to you.
Thank you, dear Isabel, for the presentation of this challenge mindset, and Estrella for the behavioral campaign. I am ex-UNDP Accelerator Lab, and we ran a behavioral insights informed campaign on plastic waste separation. And the big question that I have to you is, how do you navigate the price tag that is attached to behavioral insights? It just feels that the price increase needs to be communicated. If you can share any examples or what are your thoughts on this, would be great. Thanks.
I can go ahead and then you can also fill in. Elena, thank you for the question. If I got that right, you're asking about the price tag of now changing behaviors or designing innovative methods for doing so. It's a good question. I think our approach at UN Habitat is fairly simple. We always connect such kind of methods and processes to capacity building in a local government. And I think so in our context, because we work with local governments. So I think what is extremely important is that if you're designing new processes, new ways of thinking, you have to connect that effort to also working directly with the institution that you're also hoping to create that longer lasting change with. And so what that involves is, for instance, that in the process of including innovators and rethinking processes, solving particular challenges, you have to also engage the institution in, for instance, designing a new innovation team within the government, or designing a new way of approaching how to integrate the new solutions that have been created in the existing institutional structures. And so that's something that we have been doing fairly successfully in some cities, where they have now been able to rethink procurement systems, for instance, as a result of designing this innovation challenge. And so that is one example where we have also connected capacity building directly to the way we're designing innovative solutions in a city.
Thank you, Elena, for the question. I think very important. Let me maybe address that from also a resources budget perspective. We follow a similar approach. As Isabel mentioned, we train institutions to be able to develop their own solutions. But now the question comes: what are the resources or budget available to implement, especially knowing that behavioral change takes time? So one of the approaches we have followed is also incorporate different groups in the society, for example, the private sector, other institutions, academia, that can also combine resources and support governments in the implementation, and not only implementation, but testing and evaluation on behavioral science methods and approaches, because not everything works in the same context. So to me, I guess an answer there will be around partnerships, and what partnerships can be built at the country level to support sustained efforts or that lead to behavioral change. So with that, I will pass to you, Ruth, again, and thank you, Elena.
Fantastic. Thanks so much. I think we're about to be moved back into the other space. But if anyone wants to come in with some final thoughts as that happens, there'll still be a moment, I think, before we're moved. If you have another question or a reflection to share with the group.
I may have a general question first this time. Question to both of you, how do you deal with potential backlash? If you don't know if you have like a social norm intervention, you could also tap into something. There are people, that don't like that, especially if you deal with these social norms. Were you exposed to any kind of backlash, or what would you advise in these cases?
Backlash in what sense? In the sense of a social norm that perhaps is perceived negatively, or what do you mean, Robin, by backlash?
where, I mean, it could be different things. I don't know what may happen in your case, but where I guess people you are targeting with the intervention, they feel like, I don't know, maybe they're manipulated. Maybe you're targeting a social norm that they don't agree with because they're part of another, like, group or something like this. Yeah.
Yes, certainly, and also because there are different types of social norms, right? So the traditional approach, which is addressing those misperceptions, and some of those interventions come also with, in some cases, positive rewards for compliance, but also in some cases, some social norms efforts come with punishment for non-compliance. So certainly, yes, there are some cases where, yes, some groups may not uh, receive well some interventions. So there are different. We also include those examples, and thank you for clarifying in the toolkit the different types of intervention and specific examples, and also what could be, let's say, the result of the action, because it could be very well that it's an incentive or disincentive.
We're going to be
yes, sorry.
So thank you.
Great. Thank you everyone for rejoining the breakout. This breakout will focus on behavior change and adaptation. And we have two amazing speakers with us today, Juliana and Nathan. Nathan, I'll pass the word directly to you because we'll have a brief session only now. Nathan has actually undergone a capacity building training on behavioral science and is exploring how the behavioral indicators could enrich the monitoring, evaluation, and learning framework that Nathan is developing for two of his projects. So Nathan, I'll hand it over to you. And thank you so much for joining us for the UN Behavioral Science Week.
Thank you, Julia. That we have worked in terms of building capacity on behavioral science within our FAO sub-regional office, and also unveil some of the research questions and behavioral indicators which have come out of that capacity building process. So this capacity process was targeting a specific project. We call it PLACE. It's about pastoralism and livestock adaptation to climate change in East Africa. So the program is targeting 4 cross-border clusters within the East Africa. We have a Bal El Arab cluster out on top there. We have a Mandera cluster right here. We have a Marasergate cluster, and also we have a Karamoja cluster. It's newly launched. I think we are 6 months into implementation. We just finalized the inception phase of the program, and it's targeting at least 100,000 households across the 4 clusters. The project is looking at pastoralism in 3 dimensions. We have the environmental pillar. We have aspects to do with the land tenure, rangelands management, and water. We also have economic pillar where we are talking about pastoral value chains, private sector investments, transboundary animal disease control. And then under social pillar, we are looking at advocacy work, policy, and peace and conflict. So this journey, we have worked with USARA, who have been facilitating the capacity building sessions, plus also a team from headquarters. They've really taken us through 5 rigorous sessions, which took place over a period of 2 months. The sessions targeted staff implementing, country staff implementing the PLACE project, and also M&D's officers supporting that particular project. So in total, we trained about 37 staff. At the end of it all, we came up with some behavioral indicators, which are which have been considered for integration in the existing ML framework. We also came up with the research questions, which will be follow up with some research over time to answer those questions. these are the research questions we've come up with. I'll go through them quickly. How do individual level practices and beliefs of pastoral farmers affect the viability of pastoral farming? Next one is on what ways do community networks, social capital, local institutions contribute to or hinder the resilience of pastoral and farming communities? How do extrinsic factors such as market access, value chains, and economic diversification influence the resilience of pastoral and farming communities? Then the next one is how do policies and the regulations influence the interplay of proximal factors affecting resilience among pastoral communities? And the last one was on what are the key opportunities, interventions, and initiatives that can enhance resilience among pastoral communities. So these are the research questions which will be addressed through a well thought out protocol which seeks to pinpoint the primary behavioral factors that foster resilience within the East Africa context. The second product which came from that capacity building was identification of behavioral indicators for monitoring and evaluation. And these indicators are tailored for pastoral communities to track and understand behavioral drivers in a way that is systematic, data-driven, and directly applicable to the program design and implementation. And these indicators will be used alongside the research instruments and the protocol as part of a mixed methods approach in studying behavior in pastoral communities. So we have 7 indicators there, but I would like to highlight one of them which stood out, which is motivation. Motivation examines the economic, social, ethical, and identity-driven reasons behind pastoral communities. You see, motivation shapes pastoralists' decisions on resource use, cooperation, adaptation to environment, and economic challenges. And when we look at it, it speaks directly to the 3 pillars of the PLACE program. So in our routine monitoring work, we'll integrate these indicators and collect data through and try to learn what is changing in terms of target population behaviors. So it's important to have these behavioral indicators being part of the MIL framework and having them side to side with the research question, so that they are parallel processes which will feed into each other as part of a mixed methods approach. So the key benefits of having integrated indicators within the MIL framework is it enables understanding of participants' behavior and having more people-centered interventions. Then it also gives you key metrics that measure actual behavior change rather than focusing your M&E on the usual outputs and activities. So with behavioral indicators, you're able to measure actual behavior change and then learn from that and improve on your interventions. Then once they're integrated in your routine monitoring, you already have a systematic and data-driven tracking of these behavioral drivers. So it becomes part and parcel of everyday monitoring, and everyone knows it's their responsibility, and it will not be left behind. So having it there is important in reminding everyone we need to collect the data on the behavioral drivers. Then the last one is on facilitating adaptive, facilitating adaptive management. So if a strategy is not working, it means we need to change something about it. So if the expected behaviors are not happening, it means we have to go back and adjust our strategies to better target the desired behaviors. With also adaptive management comes the revision of the theories of change and also testing of assumption. So having collected data on these behavioral drivers, we can be informed on how to revise the theory of change and also test some of the assumptions we have put in the theory of change. So this early detection of behavioral bottlenecks provide us stronger evidence for scaling up where interventions are successful. And I'll stop at that. Happy to answer questions or take any comments about the presentation. Thank you.
Thank you so much, Nathan, and great presentation from your side. I think I especially like the last point that you iterated on how behavior science can also inform a process of failing and retrying, right? If we don't see the behavior change happening, it's not because the people are being stupid or the people are not willing or are irrational. It's just more for us to understand where they're coming from, the underlying motivations, the trust that they bring into the past experience, into how they behave today. So very interesting point. With that, I hand it over to Juliana. Juliana, thank you for also being with us during Behavior Science Week this week. And yeah, Juliana is from the Department of Management, Strategy, Policy, and Compliance. And Juliana has worked on behavior science clinics internally and how to drive change internally with different project teams. Over to you, Juliana, and very curious to hear from your insights and learning from the behavior science clinics. Thank you.
Thank you so much, Julia. I'll just share my screen. Let me know if that works. Is that okay?
Yes.
Great. Yeah, so basically, differently from FAO, what we did, so the Department of Management, Strategy, Policy, and Compliance is part of the UN Secretariat. And the focus of our intervention was internally, as you said. So it was to support a few internal teams who work with changing behavior of staff. So the focus of the change clinics, as we say, would go to actually look into the people side of change. So the focus was to build the capacity of UN Secretariat teams to apply a BeSci approach to develop and test solutions to compelling change challenges. We did that in a clinic format, which meant that we supported them. We had the initial in-person workshop to give them a little bit of the background of behavioral science and also of change management practices, which was back in September last year. And then we supported them throughout the 4 months on the design and implementation of their solutions. And finally, it wrapped up in December last year. So the approach was informed by both behavioral science and good change management practices, as I mentioned before. So the aim was really to accelerate the change processes that are linked to the work of 6 different teams, identify the tools for change that would be useful in other change contexts as well, so to also build their capacity to apply these tools in other projects and also to upscale their own project and improve adoption of the changes that they are working on by staff. So the participating teams was that managing the mobility program. So by mobility, we mean geographical mobility. And the Secretariat is still not mandatory that staff move after a few years. So it's a new thing and it's being implemented progressively. And so that means that we count on a lot of staff to opt in to be moved, which is a big shift in the mindset of a lot of Secretariat staff. Second one was performance management. We also had the anti-racism office that is working with senior advocates and also looking into how to deepen the engagement with those. Learning evaluation, so looking into not only how to assess participants of learning, but how to assess the impact of learning in the organization. Strategic workforce planning, which is establishing a new approach to strategic workforce planning based on skills. So how to get the organizations under the Secretariat to adopt this change. And also the geographical diversity team, which looks into representation according to member state representation. And the BeSci approach and principles and framework that we applied, and we had a BeSci expert working with us. I'm not a behavioral science expert, but so I was also learning a lot, was based on the EAST principles and the APs to design what we call the super nudges. Those nudges that it was felt would generate most of the impact and the change and the behavior change that we wanted to see. So we worked with 6 of teams, but I chose to share with you the impact on the mobility program. And one of the advantages that we had of the mobility program is that the clinics aligned very well with the work that they were doing. So it aligned with the opening of the opt-in period. So they had to really quickly integrate what they were learning into to test solutions. So the solution that they came up was very simple. So links to sign up embedded to sign up to be opt-in into the mobility program embedded in email messages that were sent to our staff, to have a countdown timer in communication, to show, for example, how many staff had signed in, so you compel others to do so, and also to establish a SharePoint for mobility focal points. So the Secretariat's a massive organization, is almost like a conglomerate. We have more than 100 organizations under it. So we do a lot of work with focal points in these different organizations, which we call entities. The challenge that they had was to increase the number of staff opting in the mobility scheme and decrease opt-out numbers. Now, when you opt in for mobility, you have about a month that if you change your mind, you can opt out. And in the first year, which was in 2023, they had a lot of people opting in, but most of those people had opted out within this month. So in 2024, they wanted to have more people opting in and staying in the program. And the target group was all Secretariat staff. And again, you know, the clinics were very useful because it was aligned with their project timeline. The outcome is that more eligible staff opted in and less staff opted out. So they actually got through very simple solutions what they were aiming for. So in terms of learning, what we collected through the clinics was that it was important to work with a small sample group of your target group. So for example, they were targeting all staff, so they worked initially with about 50 staff, representative of the Secretariat, to see what were the obstacles and enablers that why they would not opt in for mobility. And so the learning is that it's important also to engage those who don't want to do what you would like them to do, to understand why, what would make it easier for them to do it. The next learning is to start small, and the solutions that you need to generate need to be easy and simple, so people do it almost intuitively. And also prototype and pilot, and this has to do with start small. You know, rather than launching it across the organization, if you have a chance to work with the smaller representative target group and pilot and prototype the solution. And then that allows you to iterate. From these clinics, this is the second time we organize the change clinics in the organization. And this time we provided early in-person support. I mentioned we did a workshop in person, where all the teams came together with myself and a couple of other change specialists from the UN Systems Staff College and the behavioral science expert. And we spent a week together, also building the team spirit and also this exchange of learning between the teams as well, but also building their capacity in change management and BeSci practices. As much as possible, we also, from the facilitating team, we feel it's very important to get people in, get teams in that are able to implement what they learn as soon as possible, or as part of their project, instead of seeing the clinics as an addition to the workload. Support from senior leaders was key. So we had a senior leader at ASG or director level supporting each of the teams, and we would have check-ins with them. And I think that creates a sense also of accountability. It's 4 months, the project, so the clinic. So it's important that they keep that interaction with senior leaders, also if they are facing any challenges with integrating what they're learning. And then finally, expert support throughout. So each of us, we were a team of 4. Doing this, we were coaches for at least one of the teams. And we have the behavioral science expert also available to support all throughout the session, the clinics. So that was extremely important. And that's it from my side. I'm happy to answer any questions that participants might have, and thank you again for having me.
Thank you so much, Juliana. Great input also from your side, and super interesting as well that you were able to summarize the learnings, because it was the 2.0, the fact that you've done the clinics again and you reiterated on the previous format, and you were also sharing that it was important to have a behavioral science expert with you. I think there is a lot of similarities between how the Kenya office were able to create capacity for behavioral science within their programmatic areas, and you talking more from a change management perspective as well on how you were able to streamline it across the board and the senior management support. I think that was also highlighted very strongly, and I agree with that. I could see that Fatsi Vande has a question. Fatsi, if you wouldn't mind speaking up directly to either Juliana or Nathan, if you had any questions.
Thanks, Julia. I do. My question is for Juliana. I noticed on the one of your slides, you mentioned working with your anti-racism team as well as looking at geographic diversity. Do you remember what you actually did with those teams in terms of, yeah, I sort of, let me introduce myself. So I am the chief of DEI at UNHCR based in Geneva, and I'm just curious as to what you actually did with those 2 teams. I do have a background in behavioral science, so I'm always looking at ideas of how to integrate behavioral science in broader sort of DEI work. Thank you.
Julia, should I address straight away? Or?
I think that would be great. And then, Sima, we can take your question afterwards if that's okay with you. I hope we don't run out of time. Yes, go for it, Juliana.
Thank you. So Fatsi, thank you for this. So for the anti-racism office, what they focus on, so they work with high-level advocates across the organization within the secretariat. And what they wanted was to, at the director level, so what they wanted was to show the level of representation at the senior level of each entity as well. So what they came up with something that was very simple, but quite impactful, which was that each entity would upload the pictures of their senior leadership teams to their public websites. So just to visualize the level of representation that there is as a first step to that. For the geographical diversity team, they were more involved. They're under the Office of Human Resources. So they were more focused on how to make it easier for hiring managers in the secretariat to consider candidates from different geographical regions. So they actually created a checklist, which they embedded into our system, our talent management system, Inspira, and to help the hiring managers, to remind hiring managers to take that into consideration as well.
Okay. I think we have like 1 minute left. Seema, I'm sorry that we weren't able to cover your question, but feel free to reach out to the presenters directly if you want to address with them, maybe bilaterally. Also, we'll have another session of this coming up in the next breakout room, so you can also try to use the time for the Q&A there, if that makes sense. But Seema, I'll give you the last 30 seconds for your reflections.
Julia and Juliana, both of you, I think the work that UN people are doing is extremely valuable, and you already have a higher purpose in every department. And I talk about how to create a movement or a change through movement that is centered on purpose. And it is very powerful when people.
Hi again, everyone. Welcome back to the plenary session. So hopefully we had productive breakout groups the last little while. And you learned quite a bit about these new topics and had some good discussions. So this is the first of our expos taking place throughout the week. There'll be 2 more taking place on Thursday and Friday. I'll put in the chat some of the links about the Behavioral Science group, the resources we have, the UN 2.0 agenda, and the week. But in the last 2 minutes here, is there anything anybody would like to share about their discussions or any big takeaways, maybe from our moderators or anything? Ruth or Timon or Ashwarya? No?
Maybe just in case Isabel wanted to come in because she didn't get a chance to close in our group, that would be my invitation. But I think it was a great session and nice to, hear these deeper insights. I won't take more time.
Well, with that, then, Isabel, did you want to say something or? Oh, we can't hear you. You're on mute.
Oh, yeah, she's muted.
Yes. Hi, everyone. And yes, I think from our perspective, the question was, would there sometimes be backlash or difficulty in changing behaviors or designing things differently or in a new way? And in a nutshell, I think I can only reiterate what I'd said before. If you're going to change the way that things have been done traditionally, you might also have to put in the same effort into building capacities of those with whom you're hoping to create that change. And that's the only way that you can really lead to a new outcome. In our context, it would be working very closely with all of the innovators within the ecosystem to make sure that change is achieved in a bigger systemic way than only looking at a particular solution to a particular challenge in isolation.
Thanks for that, Isabel. There's lots there to unpack as a whole other session in itself. But I noticed as well, Julia had her hand raised. Did you want to come in with some remarks from your session or anything you wanted to share?
Yes, just also from a wrap-up perspective, I think what really connected both the internal change project as well as the in the field-based monitoring and evaluation framework that Nathan presented from FAO was the fact that we really need to understand the human motivation of why we want to change and how that is possible from really understanding their motivation first before we're trying to impose the change that's happening. So that was very interesting because both the internal change as well as the changing others part really highlighted that.
Great. Thanks for that, Julia. So this is so great. I feel like we could have a whole other session now to discuss some of the insights that we had going forward, but there'll be actually a survey at the end when you close this webinar. So if you have any suggestions or things you'd like to share with us, we can take them there. I also see in the chat, there's a question about capacity building sessions for new joiners. So there's a session on Thursday on capacity building in behavioral science, where you'll hear from a number of courses and trainings that exist in the UN. So that could be a space to get OA in. If you're in the UN, we also have some opportunities coming up for you as well. And also see Isabel has put a few links in the chat to the work of UN Habitat. And in the last minute here, if anyone else has any resources they'd like to share, feel free to do so as well. Okay, well, thank you so much for joining us in this Expo session, having a quick tour of some insights across the UN, and then yeah, we can hopefully see you at other sessions throughout this week as well. Okay, thanks everyone. Bye for now.
Thank you.
Thank you. Bye.
Bye.